Leah Tobey, and I'm a physical therapist at UAMS. The RICE method is mainly for acute injuries, whether it's an ankle or a wrist. And RICE just basically stands for rest, ice, compress, and elevate. So we'll kind of break that down letter by letter. Resting is really important and is the first component to the RICE technique because it's important to maintain the integrity of whatever joint you injured. You want to be able to stay off of it, whether it's an ankle sprain or a fracture. You don't want to be walking on it until you're further evaluated by an orthopedic doctor or a primary care physician. With that being said, resting it and staying off of it is really the most important thing to first know. The next is icing. A lot of patients will ask me, well, what's the best method to ice? Should I get ice out of my refrigerator or should I use a gel pack? It's really what your skin can tolerate, but the most important thing to know is don't over ice really beyond like 20 to 25 minutes. I typically tell my patients 10 to 20 minutes is plenty, and doing skin checks is a good idea just to be wise and prevent frostbite. Usually when you have an acute injury, ice will feel better than heat. I know from personal experience, ice is your friend when it comes to, for example, a sprained ankle. Also, what will be helpful for a sprained ankle or an acute injury is compression. You do want to pay attention to maybe your toes feeling cold or having some numbness. Those might be signs to seek other intervention from a physician, but it could also mean that your compression wrap, maybe an ACE bandage, for example, is too tight. And if that does happen to occur, just take your wrap off and loosely wrap it. You want good compression, but not so much compression that it causes some neural changes, meaning numbness or your toes being cold. And then another important component is elevation. And again, with the ankle example, I would like for your ankle to be about at your heart's level or a little bit above. So as you're resting, you're icing, and you're compressing, you can also elevate. Say if you're lying in your bed, just prop a few pillows underneath your knee and your ankle, so that way your ankle is about the same level as your heart. And the RICE method is, again, really helpful for acute injuries. One important thing to note is good hormones are released whenever you're swelling. So swelling does not necessarily mean that it's getting worse. It just means that good hormones are being released, so that actually helps the muscle tissue heal, and soft injuries will heal over time. Return to play is a little bit different story, but with the RICE technique, it can be very helpful for acute injuries.